You think he's having a good time? No, he isn't. He's suffocating. Did you know you could save his life? If you are a pet owner or veterinarian, you will be interested in this video. Hello everyone, my name is Jorge Banda. I am a veterinarian, dedicated to veterinary cardiology. In this video, I will give you a tool that will allow you to predict a condition that could kill your pet. Yes, you heard right, to kill your pet. This way you can get your pet to vet on time and save his life. So without further delay, we go to the heart of the problem. Multiple heart diseases produce a condition. Moment. Your pet doesn't have heart disease. And this information is not important for you. Well, I give you a tip. Of all dogs older 7 or 8 years, that is old dogs, just under half of it always have cardiovascular disease. But many don't show it. Here is the tip. Let's resume. Multiple heart diseases produce a condition known as congestive heart failure. This syndrome, pulmonary edema, is often the protagonist. What is pulmonary edema? Pulmonary edema, in simple terms, is the accumulation of fluid in the lungs. At this moment, let's agree without mentioning mechanisms or pathophysiology. We agree that pulmonary edema is the accumulation of fluid in the lungs. We know the lungs are the organs in charge of oxygenating the patient. Gas exchange takes place there. Therefore, a patient who accumulates fluid in the lungs, logically, suffocates and dies. In conclusion, pulmonary edema suffocates a patient and causes his death. So, one question is obvious. How can I predict pulmonary edema? Perhaps with auscultation, with X-ray, with blood test, with echocardiography. Well, yes, with the echocardiography you can. Echocardiography is the gold standard test that allows us to diagnose and predict cardiogenic pulmonary edema. Echocardiogram is a non-invasive test that allows us to approach internal cardiac pressures. In this way, we can know if the patient's heart disease is decompensated and if it has pulmonary edema at the time, or is developing it and will present it in the immediate future. Unfortunately, echocardiography presents two problems. First is that it is still a relatively expensive test. Echocardiographic equipment, i.e., ultrasound scanners with cardiac function, with the right probes, with simultaneous electrocardiographia function, a sensitive function Doppler, etc., etc., are still quite expensive equipment. And that technological development has allowed the machines to price drop in the last 10 or 20 years. But even now, are still quite expensive equipment, so testing is costly. And the second problem is not proof of immediate availability. Not many vets who perform this test. I have had clients in Peru who tell me, I contacted a doctor. I have asked for the service, but the doctor told me he has availability in 1 month, 3 weeks, 2 weeks, and I have my pet that is choking. Well, that's the reality. These limitations are presented in this test. Well, multiple studies show that calculating respiratory rate during sleep, that is, when the patient is asleep, is an extremely useful tool for diagnosis and follow-up of congestive heart failure, that is, pulmonary edema. Wait, you said respiratory rate. Just that, not multiple X-rays, not complex biochemical markers, not an MRI or CT scan. That allows us to super-image for a super diagnosis, only respiratory rate. Yes, that's right, you heard well. The calculation of respiratory rate is a simple, fast, cheap immediate access indicator. and with extraordinary utility for the diagnosis and follow-up of pulmonary edema. And here comes the important thing. In the studies, this indicator, as simple as it is, has demonstrated reliability comparable to that of the echocardiogram. And also something that I think it caught my attention is that it has predictive value. Look at the way it is so that it is understood. When a patient arrives with respiratory stress, that is, with shortness of breath, within the complementary test that I can perform is the X-ray. Then I can perform a chest X-ray. And this test will tell me if you do or do not have pulmonary edema. But it does not tell me whether the patient is currently developing it and could present it in the immediate future. The echocardiogram, on the other hand, can do it, i.e. has predictive value. And this indicator, the respiratory rate during sleep, as simple as it is, also has this predictive value, because if I have a patient whose respiratory rate calculation is at this level, and suddenly I find it at this level, I varied. That patient is most likely developing pulmonary edema. Even if it's not falling out of asphyxiation, the patient may not show much change in clinical status, but already this increase in respiratory rate is indicating to me that the patient is developing it and will present it very soon. Therefore, I will be able to take my measurements with the PET. Therapeutic, in my case because I am a vet, but as an owner, I immediately have to bring it to attention. A review as appropriate. The technique for the calculation of respiratory rate during sleep is extremely easy and simple. Basically, consists of waiting for the pet to fall asleep, and asleep, count how many breaths you take in a minute. It's as simple as that. Nevertheless, we must have certain considerations that allow this registration to be valid and applicable. First, we must be clear about the respiratory cycle. I have had clients who think that the movement of inspiration and expiration involve two respiratory cycles, and this is not correct. The respiratory cycle includes both the snow movement, in which the rib cage expands, and exhalation, in which the rib cage contracts. That's one respiratory cycle. In this way, having this clear, we can make a correct count. Second, the pet must be asleep for at least 15 minutes. If it is more, better. Third, if the patient presents panting, the registry is invalid. We must wait for the pet to stop gasping. Deepens the dream, and we repeat the record. Fourth, equality of conditions during registration. What we must ensure when we make the registration of respiratory rate during is to try the same conditions, i.e. we must measure its respiratory rate in the same place. For example, every day in the living room. At the same time, for example, every day in the living room at 10 p.m. Under the same conditions as far as possible, because we know that external conditions may affect the respiratory pattern, and also ensure that it is possible that the same person performs the registration, always, in such a way as to nullify the external factors that may bias my registration. And finally, we must make a daily record, or at least twice a week, to have a reference of that patient. In specific, if I have a patient that I have always registered, to give an example in 10 breaths per minute, and suddenly I record 20 breaths per minute, that patient increased his respiratory rate by 100%. Something is going on there. But instead, if I never did a prior checkup on that same patient, and I register, and I find a frequency of 20, I have nothing to relate it to. I don't know what's going on, and as 20 is still within the range, tolerated, accepted, for the presentation of pulmonary edema, well, I'll think everything is fine. With this example, looks very clear that we need to have a patient reference. specific to be able to, after, to relate it to the changes that are taking place. This is very important because, of course, every pet in every body, each organism, is different, and therefore presents variations between them. I will show you two methods for the calculation of respiratory rate during sleep. The first, using our chronometer, which comes by default on our cell phone, and the second one using an application. Just in case this video doesn't have any sponsorship, it's not paid or anything. Well, this is Max. It's a patient that we are conducting a complete cardiac study, and we will use as a model for this example. The first thing we must do is to open the chronometer function on our cell phone, and we will count the number of respiratory cycles performed by the pet in 30 seconds. Then, the figure we obtain is multiplied by 2. And that's all. So, we obtain the respiratory rate of this patient. For the example, if Max were asleep, its respiratory rate during sleep would be 30 for breaths per minute. And finally, she is Dana, and she will help us record respiratory rate during sleep using an application. The name of the app is Cardiocanina Seva, and simply download it to your cell phones and open it. This app has several tools, but today we will concentrate on the respiratory rate meter function. Once this function has been opened, you must simply touch the figure of the heart with each pet's respiratory cycle. After 30 seconds, the application automatically gives us the respiratory rate. It's as simple as that. First, we must make an observation. The interpretation of all the findings of a pet must be made by the veterinarian. He is the professional prepared to perform it. Having said that, what I will do is to teach you how to keep an orderly record, and I will give you a couple of critical points that should be a cause for alert to take action with your pets. The first important point is the limit values or cutoff points. That for the canine species is 25 breaths per minute, and for the cat at 30 breaths per minute. This means that if I own a dog, and its sleeping respiratory rate exceeds 25 breaths per minute, I must alert myself and bring it for prompt attention. In the same way, if I own a cat, and its sleeping respiratory rate exceeds 30 breaths per minute, I must alert myself and bring it for prompt attention. The second important point is the variation of respiratory rate during sleep with respect to its reference value. This variation should not exceed 25%. As the best way to learn is through practice. Here I have prepared a table, and we will make a record. As an example, this table, as you can see, has 4 columns. From left to right, we have the column for the date, of the
de la
time
hora,
of respiratory
de la
rate during
frecuencia
sleep,
respiratoria en sueño,
and the
de las
observations made that
observaciones
day.
que se tengan ese día
With
con
the
la
pet,
mascota.
Then we will
Entonces,
fill
iremos llenando
our table
nuestra tabla
with
con
all the
todos
records we
los
have
registros que tengamos
of
de
our
nuestra
pet day by
mascota
day.
día a día.
As I
Como ya
said,
dijimos,
we will
este
try to make this
registro
registration at the same
intentaremos
time,
realizarlo a la misma hora,
in the
en
same
el
place
mismo
of the
lugar de la
house,
casa,
under the
bajo
same
las mismas
conditions and the same
condiciones
person.
y la misma persona.
After
Una
obtaining
vez
several
conseguidos
records,
varios registros,
we will obtain the reference
obtendremos
value
el
of this
valor
patient,
de referencia de este paciente.
and this
Y este
consists of
consiste
the
en el
arithmetic
promedio
average
aritmético
of
de
all the
todos los
records
registros
made.
realizados.
For the
Para el
example,
ejemplo,
the
el
arithmetic
promedio
average of the 7 days
de los
recorded
7 días registrados que
listed in our
figuran en nuestra
table
tabla
is
es
15.3.
15.3.
We can round it down to
Podemos
15, and
redondearlo
therefore,
a 15 y por lo tanto,
the reference
el valor
value
de referencia
for
para la
respiratory rate
frecuencia
during sleep
respiratoria en sueño
of this
de este
example
ejemplo
would be
sería de
15 breaths
15
per minute.
respiraciones por minuto.
Based
A
on this
partir de
data,
este dato,
any variation,
cualquier variación,
any
cualquier
increase,
aumento
which
que
exceeds
exceda
25% of our
el
reference value
25% de nuestro valor de referencia
should be a
debe
cause
ser
for alert,
motivo de alerta,
as we will
como
see
veremos
below.
a continuación.
For our
Para nuestro
example,
ejemplo,
if the
si los
following
siguientes
days
días
I
le
recorded a
registro una
respiratory
frecuencia
rate during
respiratoria en
sleep
sueño
of
de
20 breaths
22
per minute,
respiraciones por minuto,
23
23
breaths per
respiraciones
minute,
por minuto,
evidently there is an
evidentemente hay
important
una
variation
variación importante
with respect to our
respecto de
reference
nuestro valor de
value.
referencia.
This
Esa
variation
variación
would be
sería
approximately
aproximadamente del
47%,
47%,
and that
y eso
far
excede
exceeds
en mucho
the
el
25% that we had
25% que
defined
habíamos
as normal
definido
variation.
como variación normal.
Therefore, in
Por
the
tanto,
face of
ante
such a
un cambio
change,
así,
we must be
debemos
alerted
alertarnos
and
y
bring the
llevar a la
pet to prompt
mascota
medical
a
attention,
atención médica pronta.
even
Más
more so
aún,
being that the patient of the
siendo que
example
el paciente del ejemplo
had cough in the
manifestó
days.
tos en los días
That
que
is
su
respiratory
frecuencia
rate during
respiratoria en
sleep
sueño
increased,
aumentó,
i.e.
es
expressed a
decir,
clinical
expresó un
change.
cambio clínico. Por lo
Therefore, with
tanto,
more
con
reason to,
más motivo,
we must
debemos
alert ourselves and bring it to
alertarnos y
prompt medical
llevarlo a
attention.
pronta atención.
Conclusions. Well, for me,
Bueno, para mí,
the
las
conclusions are
conclusiones saltan a la
obvious.
vista.
The
El
calculation
cálculo de
of
la frecuencia
respiratory
respiratoria
rate during
en sueño
sleep is
se
constituted as a
constituye
tool,
en una herramienta
extremely
sumamente
useful,
útil,
easy to
fácil de
use,
usar,
immediate
de
access,
acceso inmediato,
cheap,
barata, inocua, que
that
nos
allows
permite
us to assess my
valorar la
patient's
condición
respiratory
respiratoria del
condition
paciente y
and be
poder
able to predict
predecir
crises
crisis
that
que
could
se
arise and
pudieran
that, of
presentar y que,
course,
por supuesto,
have
tendrían
fatal
resultados
results.
fatales.
The
La
second
segunda
conclusion,
conclusión
and
que
for
para
me
mí
this is
es
very,
muy
very important,
importante
is that
es que
this tool,
esta
this indicator,
herramienta,
doesn't
este
replace
indicador,
medical
no
controls.
reemplaza controles.
I would
No
not want any
quisiera que
very
algún
intelligent person to be able to
inteligentísimo
think
pueda pensar
that
que
the
el cálculo de
calculation of
este
this
indicador
indicator replaces medical
reemplaza los
controls
controles
that
que
can be
se
had with a given
puedan
patient,
tener con un determinado paciente.
not
No
because
porque
a
un
patient
paciente
maintains a
tenga
respiratory
una
rate
frecuencia respiratoria
during
en
sleep
sueño
stable
estable
means that his
significa
disease
que
has
su
not
enfermedad no
progressed,
avanzó,
means that it
significa
was
que no
not
se
decompensated,
descompensó, que eso es
that it is
diferente.
different.
Por
Therefore,
lo
this
tanto,
is a
esta
tool
es una herramienta
that
que
does
no
not replace clinical
reemplaza en
controls at all.
absoluto los controles clínicos, los
Medical
controles
controls, and of
médicos y,
course,
por supuesto, las pruebas
complementary test.
complementarias que
What
se
to do with
tienen
our
que hacer
pet
con nuestra mascota
periodically.
periódicamente. Una
One
frase
sentence I
quisiera que
would
se
like you to
lleven de
take
este
away
video.
from this video. This tool
Esta
has not been
herramienta
replaced
no ha
by,
venido a reemplazar,
has
ha
come to add
venido
up
a
to,
sumar. Sumar
is
es
one more
la
piece of information
información
that
más
reaches the
que
clinician,
le llega al clínico,
to the
al cardiólogo o
cardiologist
al
or
médico
clinician,
clínico,
that
que le
allows you to
permite
make
tomar
decisions
decisiones
with
respecto
respect
de
to
la
therapy
terapia
and
y
management
con
of a
un
given
determinado
patient. And
paciente.
finally, well,
Finalmente,
this
bueno,
is
esta
my
es una
opinion,
opinión
is
un tanto
subjective.
subjetivo. A
I
mí me
get
da
the
la
impression that this
impresión
tool gives
de que
a
con esta herramienta se da una
complementarity between vet
entre el médico veterinario
and the
y el
pet
sanitario
owner.
de mascotas.
It
Me
seems to
parece
me we achieve a
que
joint work by
se
seeking to
logra un trabajo conjunto procurando
the
el
pet's
bienestar,
welfare,
que
that is
finalmente es lo
ultimately
que
what
todos
we all
queremos,
want, the
del
patient's
paciente, el
welfare.
bienestar de la mascota.
So
Así que
for
para
me,
mí
is a
es una
tool that also
herramienta
adds
que
to the
además
interaction
suma a la interacción
between vet
entre
and
el
pet
médico
owner.
veterinario y el tutor de mascota.
Finally,
Finalmente,
I hope you
espero
have
que
found
esta
this information
haya
useful,
resultado útil
and
y
I
te
invite you,
invito
if you have
a
any
que si
questions,
tienes alguna duda,
then leave it in the
la dejes en los
comments,
comentarios,
as I
ya que
always try to
intento
answer them as
siempre
much as possible.
responderlas en lo posible.
And of
Y,
course,
por
please
supuesto,
give it a
por
nice
favor,
like
denle un buen like
and
y
share the
compartan el
video
video
for
para
this
que esta
information to
información
be
le
reaches
llegue
the
a la mayor
largest quantity
cantidad
of vets,
veterinarios,
veterinary
estudiantes de
medicine
medicina
students,
veterinaria,
and also
también
pet
para
owners.
de mascotas. Para
For the
algunos
vets
veterinarios
and
estudiantes de
veterinary
medicina
medicine
veterinaria
students,
que
they wish
deseen,
the
la
bibliography
bibliografía
referenced
referenciada,
here. In the
los
comments,
comentarios
put the
pongan
word
la palabra
bibliography,
bibliografía
and I share them with
y
you.
se las comparto.
So
Así
thank
que
you very much and
muchísimas
see you next
gracias y
time.
hasta la próxima.